What if you could peek inside and see how your baby is doing? Well, that's exactly what prenatal ultrasounds allow us to do. Often referred to as sonograms, these medical scans are a routine and vital part of prenatal care. They provide a window into the womb, offering expectant parents a first glimpse of their developing baby. Prenatal ultrasounds use high-frequency sound waves transmitted through the body via a device called a transducer. These sound waves bounce off the baby's bones and tissues, and the echoes are converted into images that reveal fascinating details about the baby's health and development. This technology allows healthcare providers to monitor the growth of the baby, check the position of the placenta, assess the amount of amniotic fluid, and much more. It's an essential tool that helps ensure the well-being of both the mother and the baby throughout pregnancy. So how do these fascinating procedures actually work? Let's dive in. Imagine using sound waves to paint a picture. That's the basic science behind ultrasounds. When you hear the word ultrasound, you might instantly think of pregnancies and baby images. But let's delve a bit deeper into how this fascinating technology works. Ultrasounds use high-frequency sound waves to create live images from inside the human body, like a sonar system used by submarines, but much more intricate and, of course, much safer. The process begins with a device called a transducer. This handheld instrument emits sound waves that are too high-pitched for the human ear to detect. When a healthcare professional gently presses and moves the transducer across the belly, the sound waves penetrate the skin and tissues. As these waves encounter different densities, like those of fluid, soft tissue, and bone, they bounce back to the transducer. It's this echo that is key. The transducer captures these echoes and sends them to a computer, which interprets the data to construct an image. Remarkably, these images appear on the screen in real time, providing a dynamic view of the developing baby. Importantly, the sound waves used in ultrasounds are non-ionizing. This means they don't carry the same risks as ionizing radiation, such as that found in X-rays, making them a safe choice for monitoring prenatal development. With this technology, medical professionals can gather crucial information about your baby's development. Did you know there are different types of ultrasounds? Each serves a unique purpose. Let's dive into the two main types of prenatal ultrasounds, transabdominal and transvaginal. First, the transabdominal ultrasound, which is perhaps the most commonly envisioned when thinking about pregnancy scans. This type involves applying a small amount of gel on the belly. A device called a transducer glides over the gel, sending sound waves through the abdomen to create images of the baby. Typically, this method is used throughout the pregnancy, but is most effective after the first trimester when the baby has grown larger. On the other hand, a transvaginal ultrasound is often used in the early stages of pregnancy. It provides a closer look when details are too small to be clearly seen via the transabdominal method. For this type, a specially designed probe is gently inserted into the vagina. Like its abdominal counterpart, it uses sound waves to create images, but it's closer to the pelvic organs, offering clearer views of the early stages of pregnancy. This method is particularly useful for checking the baby's heartbeat and examining the cervix. Both methods are invaluable tools in prenatal care. The The transabdominal scan is less invasive and generally used as the pregnancy progresses, while the transvaginal scan is more detailed for early pregnancy assessments. Both types provide valuable insights, but the preparation and process differ slightly. Getting ready for your ultrasound? Here's what you can expect. When it comes to prenatal ultrasounds, there are generally two types you might encounter: transabdominal and transvaginal. Each serves its unique purpose and requires slightly different preparation. Starting with the transabdominal ultrasound, this is the type most people are familiar with. Before the procedure, you'll be asked to arrive with a full bladder. It might seem a bit uncomfortable, but a full bladder helps by pushing the intestines away and providing a clearer view of the uterus. To prepare, you'll typically need to drink several glasses of water about an hour before your appointment and avoid using the bathroom until after the scan. Upon arriving, you'll be guided to a room where the examination takes place. Here, you'll lie down on a comfortable examination table, and the area around your belly will be exposed. A clear, water-based gel will be applied to your abdomen. This gel helps eliminate air pockets between the transducer, a handheld device, and your skin, which enhances the sound waves that produce the ultrasound images. The healthcare provider will then glide the transducer across your belly, pressing slightly. As it moves, it sends sound waves into your body that bounce back to create images on a monitor. You might feel a bit of pressure, but generally no pain. During this process, you may see the first glimpses of your baby, from the curve of a spine to the beating of a heart. For a transvaginal ultrasound, the preparation is different. You don't need a full bladder. Instead, you'll change into a hospital gown and lie down with your feet in stirrups. A smaller transducer, covered with a protective sheath and lubricated, is gently inserted into the vagina. This type of ultrasound provides a closer view, which is especially useful in early pregnancy or for clearer details. Both procedures allow you to hear sounds like blood flow or your baby's heartbeat, adding an incredible layer to the experience. Although it might sound complex, ultrasounds are generally straightforward and comfortable. Beyond just getting a sneak peek at your little one, ultrasounds have numerous benefits. Imagine being able to chart the course of your baby's development, from a tiny cluster of cells to a kicking, gurgling infant ready to make their entrance into the world. That's the power of prenatal ultrasounds. These scans provide a window into the womb, giving vital information about your baby's growth and development. One of the primary benefits of an ultrasound is the ability to determine the age of the pregnancy. Accurately knowing how far along the pregnancy helps in predicting the due date. This is crucial not only for anticipating the big day, but also for scheduling necessary prenatal tests at the appropriate times. Moving on from age to size, ultrasounds can measure different parts of the baby's body, such as the head, abdomen, and femur. These measurements help in assessing the baby's growth rate and can indicate if the growth is on track according to gestational age. The position of the baby and the placenta are also checked during these scans. The placenta's location is significant as its position can affect delivery options. For instance, a placenta previa, where the placenta covers the cervix, can lead to a need for a cesarean section. Moreover, Ultrasounds play a critical role in monitoring the baby's well-being. They check the heartbeat, movement, and even the amount of amniotic fluid around the baby, ensuring that the environment in the womb is supportive of healthy development. What about potential issues? Ultrasounds can detect abnormalities or conditions that might require further tests or special care, such as signs of genetic disorders or an ectopic pregnancy, where the embryo implants outside the uterus. Lastly, the reassurance that ultrasounds provide cannot be overstated. Seeing a healthy baby and hearing its heartbeat can bring immense comfort and strengthen the bond between parents and their unborn child. This makes ultrasounds an indispensable tool in prenatal care. What happens after the ultrasound session? Once the ultrasound is complete, the immediate next steps are quite straightforward and reassuring. Typically, individuals can return to their normal daily activities almost immediately. There's no downtime required, which means you can drive yourself home or even go back to work if you feel up to it. The ultrasound images captured during the session are meticulously analyzed by healthcare professionals. These images are vital as they provide a clear picture of the baby's development and the overall health of the pregnancy. This analysis is crucial in ensuring that any potential issues are identified early on. Following the analysis, the results are compiled and sent to your healthcare provider. It's important to schedule a follow-up appointment to discuss these findings. During this meeting, any necessary steps or additional tests will be discussed based on the ultrasound results. Always feel free to ask your doctor about the results and any further steps. We hope this glimpse into the world of prenatal ultrasounds has been enlightening. From uncovering the fascinating science behind how ultrasounds use sound waves to create images, to exploring the different types, transabdominal and transvaginal. It's clear that this technology plays a crucial role in modern prenatal care. We've walked through what happens during each type of ultrasound, ensuring you're prepared and comfortable. The benefits, too, are manifold, from assessing the baby's growth and health to providing peace of mind through visual confirmation of your little one's development. Remember, ultrasounds are generally safe and are a pivotal part of ensuring both your health and that of your baby during pregnancy. They offer a window into the womb, allowing for early detection of potential issues and helping to plan necessary follow-up care. Thank you for watching. If you found this video helpful, remember to like, share, and subscribe for more informative content. Wishing you all the best on your journey to parenthood.